It's not always necessarily 6 months for every person. There are some people that are totally fine with 12-month recalls. There's also probably quite a few more that really need 3-month recalls or 4-month recalls. The thing that happens most rapidly in the mouth is bacterial invasion, and this can happen with poor home care or inadequate dental cleanings or infrequent dental cleanings. And so I think once the dentist and the hygienist have made their first look, they can kind of customize that frequency to be just right for you. Lack of education is probably number one. A lack of education and knowledge about how the health of your mouth ties into your overall health. That's number one. Number two is probably complacency. I would say there are a lot of people out there who don't have any pain right now. I'm not having any pain, I'm okay. Well, when they come in a lot of times and they do have an infection or a tooth that's hurting, it's not unusual to find another handful of issues at that same time. And so I think complacency is a problem. It's amazing how many people think if they don't have pain that they don't need a dentist, and nothing could be further from the truth. The time you really need the dentist is before you have the pain. And I'd say number three is just poor home care. We get busy with our lives, we get out of our routines, we maybe either don't brush and floss adequately because we don't know how, or we don't care to do it. The biggest myth in dentistry is that the health of your teeth is directly related to how much sugar you consume. That is an absolute myth. It's not the amount of sugar you consume, it's the frequency with which you consume it. What you should do is you should compress your carbohydrate exposure. Carbohydrate and sugar, you want to have shorter bursts. Then afterwards do something to neutralize the acids that are going to be produced by the bacteria that naturally live in your mouth. So maybe a good sugarless chewing gum to help stimulate saliva production and help break down the dental plaques, and then don't eat any carbs for a while.